And of course, they will go back to the cardiologist and tell the cardiologist, yeah, I'm only taking the statin. My HDL went from 30 up to 60. And it did that only on the statin. And the doctor, yeah, that's great. Look at how great this is. Yeah. And then on occasion, those patients will say, I'm not on the statin. I stopped taking it. What? You got to take it. Yeah. But when I was on the statin, my HDL was still 30. Off of the statin and on the testosterone, my HDL is now 60. You saw in part 3, Dr. Peng's labs, who's a cardiovascular surgeon. His HDL baseline was 32. And once he got on all of the hormones, his HDL went to 75. There's no cardiologist that can take an HDL of 30 and raise it to 75 repeatedly on all these lab tests. There's no cardiologist that can do that. What does it do to the small LDL particle number and the LDL particle number? It bottoms it out. What's it do to ApoB? It puts it down to a level that there's no way can be achieved with a statin. And they reject it. Oh no, you shouldn't be on that. Well, look at my numbers. You don't think my numbers are good?
and we're starting to see more research on how important HDL triglycerides ratio is. So tell us about, we already said testosterone increases HDL, which is good for cardiovascular protection. What about triglycerides? What does testosterone do with triglycerides?
It lowers it, of course. And as you well know, all the studies using fibrates that lower triglycerides, unfortunately, do not improve outcomes. And the reason is the fibrate, which can lower triglyceride, that's a surrogate number, doesn't really mean anything because all the studies show that it didn't work, which is why most cardiologists don't even use fibrates anymore. So why? Why do the fibrates not work when they lower triglycerides? Because they don't lower the visceral fat. You have to lower the visceral fat. So it's not how you lower the triglycerides. It's not lowering the triglycerides. It's how you lower it. And you lower it with testosterone, which reduces the visceral fat. We know what that does. When you lower the visceral fat, it decreases triglycerides significantly. And it reverses that dyslipidemia with high triglycerides and low HDL that most people have. And even though their LDL cholesterol is 25 and they're on a statin, the triglycerides are still high and the HDL is still low. And that's the risk factor. That's what's driving the disease process that the cardiologists completely miss because they're so focused on statin and ApoB, and we don't know what to do with the triglycerides or HDL, so we'll ignore it. But wait a minute, what do you mean ignore it? The most recent literature and the lipidology literature shows the most recent study. If you don't lower the triglycerides and raise the HDL and the ApoA, the apolipoprotein A, if you don't fix that, the disease will still continue to progress, which is what they completely miss. But they don't know how to fix the triglycerides HDL, so they sort of ignore it. And that's what Dayspring and Snyderman talk about. Well, yeah, there's problems, but we don't know how to fix that because the drugs didn't work. Yeah, we know how to fix it. Look at all the studies where when you lower the triglycerides and raise the HDL with testosterone, it works. It fixes the problem. But since there's no drug to do that, we'll just ignore the apolipoprotein A and the HDL because we don't know how to fix it, even though it's probably the most important, significant risk factor for driving cardiovascular disease, and we don't know how to fix it, so we'll ignore it.
And there we answer the question that you ask in a lot of your presentations. What if we had a drug that could? Well, it's testosterone.
All of that. If we just had a drug that would do that,
right?
Yeah, it'd be great. It would sell like hotcakes. Right. It would be the most prescribed medicine in the whole entire world. And here's the drug. Well, you can't use that. You shouldn't use that. No, you don't want to. You don't want to take testosterone. It's really sort of fascinating how beneficial it is, and we've got it, and it's rejected and ignored. Just thoroughly amazing.